Hey everybody, Dr. Chris with Executive Health Solutions. Just wanted to make a video on some deep back muscles and some rehab for a specific procedure. I had a friend who had the Regenexx injections deep into the back for the degenerative disc disease, or DDD. This is one treatment that would be non-invasive or minimally invasive. It's not surgery, but it uses your own stem cells from your blood to regenerate some healing. Now, for him, the specific exercises I wanted to show him, I'm going to tape today, and then hopefully I'm going to send this video to him. But then I was hoping other people could possibly benefit as well. So specifically, we're talking about some of the deep back muscles, the multifidus, rotatores, some of the spinal erector muscles, the ones that connect in between the actual spinal vertebrae, and then sometimes they connect from the transverse process over to the spinous process, or up and down from vertebral body to vertebral body all the way up. They're important in the stabilization and in the movement of the spine. Also think the popular one people hear a lot of, the transverse abdominis or the core, for that stabilization. So I'm going to start with some very simple ones because he just had this done last week. So he's, at this stage, we're going to start real simple and just start with activation of some of those deep muscles, and then we'll slowly work our way up. So the first one I wanted to work on, I'm going to see if I can get the camera just right here. I'm going to pause it for a second. Okay, so I'm sitting on the edge of a bench or a chair. So in this example, we're going to work on what's called a slouch overcorrect. You can see my spine through here is fairly straight, and I want you to bend, or let your pelvis rock backwards and slouch, and then contract the deep ab muscles and the back muscles, because the multifidus and the rotatores, some of those deep back ones we're working on, are extenders of the spine, which means they help bend backwards. They also help with rotation, which is twisting and side bending. But let's first start with the extension. Then you come from the slouch position up to the overextended and concentrate on shortening those spinae erecta and that whole group of muscles in the deep back, the multifidus and the rotatores, and then come out of it, and then come right back up, overcorrect, rock the pelvis forward, and contract those muscles there, tight. 1, 2, 3, should still be able to breathe, also contracting the transverse abdominis, and down, up, hold, 4, 5. So this is a very simple, little bit of movement through the spine, not much, helps the helps keep the blood flowing, get a little bit of activation in those muscles back there, tight, 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 breathing. All right, so that's a little bit of a slouch overcorrect. Let's go to the next one. Okay, the next one is lying supine, or what's called hook lying, which means my knees are bent. I'm going to try to show so there's a slight curve in the back there. We're going to activate the transverse abdominis and the lower, and those deep back muscles, and feel like we're trying to smash or rotate the pelvis back a little bit and smash that hole or that cavity in the low back and push it down against the floor flat. So we're still breathing normal, because we can use the transverse abdominis in a contracted way and still, breathe and talk and everything else. It's not an ab move. It's a deep core move. And then come out of that. You see how it kind of rocks back up. Natural, so my natural lying position. And then we're going to contract and push back down and kind of push that hole down there and push it flat. Hold, 1, 2, 3, 4, 5. Tight, tight, tight. And relax. Push it down again and hold. Again, this is a very simple, or beginning. It's not simple. It takes time. It actually takes some practice to get the right muscles to contract, but it's a beginning move for someone who just had this procedure done. Tight there, and relax, and tight. Okay, that's that one. Okay, so now I've come to, a prone position or face down. Now we're going to activate some of those muscles against gravity, a little bit, it's probably just a step up as far as the intensity or how hard it is, but we'll go prone, flat prone this way, and then we'll activate those back muscles by bringing one leg up. So as I kick that leg up, I'm activating my glute muscles, but also my lower back muscles, the deep ones, multifidus, rotatores, the spinae erecta, even some of the lats and the thoracolumbar fascia down there. Hold, and let's do the opposite side, now the left side. A little bit of rotation even, which we know those work on rotation as well. Lift up. So we can start with just legs, or we can start with just arms. Okay, right arm, left arm, a little bit higher. This would be for a little bit higher in the lats and the rhomboids, depending on where the injection is. Maybe good to do, you know, both of those. The next progression would then be to go opposite arm and leg. See if I can get myself in here like this. Back up a little bit so you can see. Okay, so I'm going to go right arm, left leg together. Okay, hold. Then left arm, right leg up. Okay, rotates, a little bit of rotation and opposite here. Right arm, left leg. Left arm, right leg. Okay, then you can go from there up into what will be considered quadruped. I'm going to change the angle of this here. A little higher. Like that. Okay, so from here, we can just go with kind of standard like cat, camel, or cow, camel, you know, where you let the stomach sag down into extension, and then come up and round. So back and forth this way, keeping the stomach and those abs and transverse abdominis tight the whole time, pulling that belly button like you're pulling your belly button up through to your spine. Pull that belly button up into your spine. Up and down, up and down, up and down. Okay, work on those. Then since we're in this position, similar to the ones where you're on your stomach, we could go just leg and hold. Now again, your weight wants you to tip this way. You have to counteract that with some of the stability of those muscles. Okay, go just legs. So right then left. Hold, flat like a tabletop on the back. On each side. Hold. Okay. Left leg. All right, the next progression of that would be to add, or you could just do arms as well without legs, just arms, okay? Or the next progression would be to go, again, just like we did on the floor, face down, opposite arm, opposite leg. So right arm, left leg, and hold. Tough, because it makes you want to tip. At first, you might be all tippy and all wobbly. That's okay. Just keep working on it. Tuck that stomach in. Okay, switch. Left arm, right leg, hold. Should be very stable. I know it's going to be tough at first, okay? Back. Hold. Sometimes I call this a bird dog. You picture like a dog pointing. That's how you want to be nice and steady and still with it. Okay. That's the progression from floor to hands and knees. Okay, the final two probably for this demonstration, because we can get deeper into this as the weeks go on. There'll obviously be a progression of forces and a progression of the intensity of the exercises. Remember we talked about, briefly I mentioned, those deep back muscles help with extension, but they also are important for rotation and then side bending or side flexion. So I'm gonna do just a couple of easy rotation ones to start with. And then like I said, for this video, that's probably 5 or 6. That's enough for now, and we can get some more into this. I can make some more if there's enough interest. But I mean, for my friend, I'm obviously going to show him, keep him going on this. Just a starter for everybody else. I'm going to do a ball first. So this is go light. This is like 10, but you can go even lighter, like 5. And then we're just going to work on just purely rotation over from this right hip up to like the left shoulder, right hip, to left shoulder. I'm keeping my pelvis straight. I'm not moving with my hips, I'm moving with my lumbar, my spine, keeping the transverse abdominis tight. And then we're going down to the right hip and left, rotation, rotation. Now we can switch obviously and go left hip and up. Keep the ball close to your body, it's easier to start with. As we get more advanced, we'll bring the ball further away and we'll go through a further, bigger motion as we get deeper into this and a little more advanced. And again, it'll be the opposite, lower left, upper right. So to start with, we're going close and just little baby rotations, okay? The other way we could do it is, if you didn't have a ball, I got some light bands, very light. Yellow is the easiest resistance. I have a little doorstop, put that in there. Okay, and then we could do, I'm gonna be on that, I'm gonna just change this angle here a bit. There we go. So we could start with a very easy row, just bringing those shoulder blades back in together, but you have to stay tight through here. Tighten the transverse abdominis. Remember, it's that slight little posterior tilt, like that. Keep that tight in there. And row, 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 just like this. There we go. And then you could go from here, like we did with the ball, and you could bring it across, twist, and then back slow. Twist, then back slow, keeping everything tight in here. Those rules apply through all of these here. That takes probably the most discipline and the most practice to keep all of this tight, and the low back, mid back, depending on where that procedure was for you. Tight, 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 okay? The opposite again, I'm going to get back to you, but we'll go to the left side. You just switch and turn, okay? Now we can always play with angles on these. Later we can play with different angles from low to high, from high to low, kind of wood chopping, different angles. But for now, for a start, that's probably a good 10-15 minutes of exercises right there to go through the day. And I'll give you some more when the progress happens, which is going to be just within weeks. I mean, this is a pretty procedure that gets that your own blood, your own stem cells working and regenerating and healing your own tissue, which is pretty cool, I think. So again, Dr. Erickson with Executive Health Solutions. If you had any questions, post them in the comments below. I'm going to put this video up on YouTube on my channel, and then probably I might even post it to Facebook. But for sure, I'm going to share it with my friend who's going through this process right now, and hopefully, with his results, we'll see how it goes. I can post again. Thanks.